Ovarian cancer symptoms that every woman must know. It is one of the deadliest types of cancers in the world, but this is not because it's more difficult to treat than the others. The high mortality rate recorded from patients of ovarian cancer is mostly as a result of late detection. As a result of how regular the early symptoms of ovarian cancer look, a lot of people never realize that they are suffering the deadly illness until it has grown beyond control. In today's video, we'll be looking at 7 symptoms of ovarian cancer that you must know. Make sure you watch the video to the end, as every symptom listed in this video can be the difference between life and death. Number 7. Bloating. Bloating could most times be a result of an excess buildup of gas in the intestines, constipation, IBS, gastroparesis, and of course, menstruation. However, for people with ovarian cancer, the bloating is usually caused by ascites. This is the result of fluid building up in your abdomen. Ascites usually form when the cells of cancer spread to the peritoneum. Furthermore, whenever the cancer blocks some parts of the lymphatic system, it causes fluid to build up since they cannot drain out normally. Bloating is usually the first sign of ovarian cancer that shows up. However, we don't suggest you start panicking once you start bloating. Just like we mentioned earlier, there are a host of other illnesses that can cause bloating. Just seek medical attention as soon as possible, as your doctor is the only one that'll be able to determine what the cause of the bloating is. Most women ignore seeing their doctor whenever they experience constant bloating. However, if the bloating is not going away and it continues to get worse, picking up more symptoms as it goes, then you must see a doctor as soon as you can. Number 6. Period changes. There is a wide array of reasons that could cause changes in the menstruation cycle of a woman. Irregularities in a woman's menstrual cycle is commonly caused by pregnancy, stress, strenuous exercises, low body fat, or hormonal imbalance. However, one to add to this list, though rare, is ovarian cancer. The American Cancer Society has confirmed that ovarian cancer can have an effect on the menstrual period of a patient. The changes to look out for include excessive bleeding or bleeding heavier than normal, or irregular flow. Ovarian cancer could also cause a person to miss their period completely. Generally, a standard menstrual cycle is between 24 and 38 days. The exact length of a person's cycle is specific to the individual, and there could also be changes by a few days as the months pass by. You should first have a record of what is normal for you in terms of the cycle length and the longest and shortest changes that you've experienced. Note that if you experience a menstrual cycle that varies by more than 7 to 9 days, then you are having irregular periods. If you experience no form of bleeding within a whole cycle, then you have missed a period. Scientists are yet to understand the link between irregular periods and ovarian cancer. However, research shows that women who have irregular menstrual cycles are twice as likely to develop ovarian cancer by the age of 70, compared to women with more regular menstrual cycles. Number 5. Pains. When you feel consistent pains in your abdomen, pelvis, and/or lower back, and it continues for more than 3 to 4 weeks, there could be some possible conditions at hand. This is probably one of the most vague symptoms on this list so far, considering that there are so many conditions that it can be tied to. But there are a few checkboxes that can help narrow it down. You should answer questions like, is the pain new to you? Is it continuous or on and off? Are there other possible factors you can link to it based on past experience? Sometimes pains like these are just symptoms of stress, trying to get you to take a break from your ever-busy life. Other times, the pain might subside when you make some changes to your diet, since gastrointestinal issues also manifest in this form. Sadly, it's not exactly possible to tell the difference between symptoms of ovarian cancer and gastrointestinal or stress-induced pains. This is why most women have to go through a number of specialists before there is a proper diagnosis. If you're facing these symptoms and they don't seem to be going away, even after you've tried different medically recommended options of relief, you can save time by getting your doctor to run certain tests. You can avoid the stress of going from one specialist to another by taking a pelvic exam, GI evaluation, a physical exam and GI tests, blood work, CT scan, MRI, or ultrasound. All of these will help doctors get the diagnosis a lot faster. Number 4. Constipation. This is something you would usually find in patients with irritable bowel syndrome. However, it could also be a symptom pointing at possible ovarian cancer. Interestingly, some women have been wrongly diagnosed of irritable bowel syndrome Meanwhile, there was a tumor growing in their reproductive areas. Symptoms of IBS are not to last more than 3 weeks. So if after taking treatment for IBS, you continue to experience symptoms like constipation, nausea, and diarrhea for more than 3 weeks, then you have to go back to the doctor for more cancer-related tests. The risk is higher for women who have had any history or family history of breast, ovarian, or any cancers at all. Typically, the doctors would perform a colonoscopy to find or rule out colorectal cancer before moving on to other tests, depending on the uniqueness of your symptoms and cancer-related records. Either way, knowing when the constipation symptoms have tarried longer than usual is important. You should also check for what other symptoms that are accompanying the constipation. Number 3. Bladder function changes. Routinely, whenever women start having urinary problems, painful passing of urine, or urgency when they have to, it is associated with urinary tract infection, which it usually is most of the time. However, symptoms that affect the bladder could also be pointing you in the direction of a gynecologic or even a reproductive condition, for example, ovarian cancer. Before you get too scared, there are specific symptoms to check first before concluding that your urinary issues are ovarian cancer related. If you feel a lot of pressure or pain in your bladder, even when you're not pressed, or you're visiting the bathroom more often with an excessive frequency, or you just always suddenly urgently need to pee, then there just might be a cause for concern. All of these are urinary symptoms that experts have said to be connected to ovarian cancer. If you start experiencing these symptoms out of the blue, and they persist for days, running into weeks, then you have to talk to a doctor as soon as possible. Inform them that you have noticed changes in your urinary system and you have concerns about bladder function and issues concerning your reproductive system. They should know where to start and what to do based on your health history. Number 2, appetite loss. Being sick in general can make a person lose interest in eating. However, loss of appetite is an active symptom of depression, and it's also been linked to some forms of cancer, especially those related to the gastrointestinal tract. Apart from ovarian cancer, stomach cancer, pancreatic cancer, and lung cancer can also manifest themselves as appetite loss symptoms. Sometimes the cancer itself causes the body to go through some metabolic changes. These cancers put pressure on the stomach and make you feel too full, even when you haven't eaten as much as usual. Like with all the other symptoms we've mentioned so far, if this symptom is new to you, and it's accompanied by any of the other aforementioned features, make sure you reach your doctor immediately. Number 1, fatigue. Keep in mind that fatigue and tiredness or lack of energy are two very different things. With regular tiredness, you'll find it going away after a few hours of quality rest. However, fatigue, on the other hand, will keep you down no matter how long you rest. There have not been any completely conclusive investigations into how fatigue is a symptom of cancers like ovarian cancer. However, some studies by the American Cancer Society showed about 38 out of 98 patients of ovarian cancer recorded a fatigue score of over 12, meaning that they could be described as suffering from fatigue. In the end, it's been proven that a large number of ovarian cancer patients suffer from fatigue. So if you begin to feel unnecessarily tired after performing little or no strenuous activity, and rest has not been able to solve the problem, then you must put a call through to your doctor. As you can see from everything we've listed so far, it's clear just how vague the early symptoms of ovarian cancer can be. Unfortunately, not all of these symptoms will manifest at the same time. But take note of how long the symptoms last in your body. Whenever ovarian cancer is detected at a very early stage, the survival rate is a sky-high 90%. This means that it can be very easily treated. However, it is recorded as the 5th highest cause of cancer-related deaths in women just because of late diagnosis. By the time most women are diagnosed, that's when they realize that they must have been having symptoms for months, but by then, it's too late. For this reason, you must report to a doctor once any of the symptoms on this list become persistent and last longer than normal, even after recommended medication. Comment down below your thoughts, give this a like, share with your friends, and don't forget to hit the subscribe button and notification bell to keep you updated for more interesting facts, tips, and ideas from SmartVille.